Join the BBC's news teams where you are.
Welcome to BBC Points West with Alex and David.
Our main story tonight, Oliver's legacy. Thousands of staff are to receive special autism training after he was given a drug he was allergic to at Southmead Hospital.
When NHS staff and social care staff receive this training, they will see Oliver's face and they will remember that he is the absolute reason why we've got this training.
We'll be hearing why this sort of specialist knowledge is so important.
Our other headlines tonight: he's like a son to us. Can a 100,000 signature petition stop Samet being separated from his foster family and deported?
The plan to ban all private diesel cars from central Bristol. Councillors say yes to get it up and running.
And a teenage fencing champion from Swindon. But when it comes to paying the bills, who's got his back?
Good evening. Tens of thousands of health workers across the country are to receive extra training following the death of an 18-year-old man who had autism.
Yes, Oliver McGowan died in Southmead Hospital after being given a drug that he was allergic to. Here's our health correspondent, Matthew Hill.
Hello, this is day one of the 22 press-up challenge I've got to do.
Oliver McGowan was young and physically fit, but he was also autistic with a mild learning disability. Even though his care notes clearly stated he was allergic to antipsychotics, he was given them whilst being treated at Southmead Hospital.
But Oliver himself had made it clear. But sadly, because I believe of his labels attached to his being, his autism and his learning disability, that medication was given that evening without us knowing about it. And sadly, it caused Oliver's brain to swell so badly it was coming out the base of his skull. And Oliver lost his life.
While the coroner found there were no failings, there is an independent inquiry underway into the wider circumstances surrounding Oliver's death. But today, Oliver's parents have something to celebrate with the government's announcement of a £1.4 million training pack in his memory.
This is for everybody, so it's not just medical staff, it's everyone that might come into contact with patients. So you know that yourself that if you have a negative experience with a GP front desk, with a receptionist, for example, it can ruin your day. But if you're an adult with learning disabilities or an autistic person, that might actually stop you wanting to go back to that doctor's surgery again, and some long-term health conditions might not be picked up.
Had this training been around at the time Oliver was treated at Southmead, his death may have been prevented.
When NHS staff and social care staff receive this training, they will see Oliver's face and they will remember that he is the absolute reason why we've got this training. It's because Oliver lost his life in a way that he should never have done. So yes, it is Oliver's legacy and we're very proud. It's a way of Oliver giving back. But we must also remember exactly what it's all about, and it's about getting this training to try to prevent some of these horrendous deaths that are happening in our country.
His family's one consolation is that other patients will be listened to in future. Matthew Hill, BBC Points West.
Dan Scorer is Head of Policy and Public Affairs at the learning disability charity MENCAP, and he joins us now from our London studios. Thanks for coming on tonight. In practical terms, what will change as a result of this training?
Well, it will mean that all members of staff working in health or social care settings will get detailed training appropriate to their role around learning disability and autism, and about the key changes that they can make to ensure that every person with a learning disability or autism gets good quality care, whether that's really simple changes like giving people more time to respond to questions, giving people a quiet space to be examined in a hospital, or providing people with easy read information in the case of people with a learning disability. All really important things that can make a key difference to the experience that people have in health and care and to the outcome that ultimately they experience.
OK, so when someone with autism is admitted to hospital or comes up across a doctor or a nurse, they need special arrangements for them, don't they? Because it's an unfamiliar environment.
That's right, they may well do. That if you're a person with autism or learning disability going into hospital, it can be very confusing, it can be noisy, with bright lights, with lots of staff talking to you. And if those staff don't have any understanding of the impact that can have on a person and their ability to communicate and actually say what's wrong with them, it can mean that really important symptoms or illnesses can be missed, and potentially that could lead to people dying avoidably. So this training has the potential to save lives.
So it's understanding that this could be potentially a very frightening and confusing environment.
That's right, and also thinking about the important changes that doctors, nurses and other professionals can make in the way they communicate with people with a learning disability and autism, and the way that they work with families who have so much understanding about their loved one, and making sure that they listen to families' knowledge and act on that.
But it's 2019. Why are we only finding this out now?
Well, we're not just finding this out now, unfortunately. We know that 1,200 people with a learning disability die avoidably each year, and these issues have been known about for a long time. We've been campaigning with families like Paula's and others for this training for a number of years, and it took a government review that looks into deaths of people with a learning disability to make this recommendation to spur the government into action. And today we have the welcome news that it's now government policy and it's going to be rolled out in the next 2 years.
Well, it's quite some legacy, isn't it, for Oliver? Thank you so much for coming on the programme tonight. Thank you, Dan.
A family from Bath has been forced to hand over more than £8 million worth of houses and other assets following a proceeds of crime inquiry. Investigators believe the Davies family had been able to buy the properties as a result of the sale of drugs and mortgage fraud.